Alright, so I'm the negative side of euthanasia, and I would like to first start off by defining euthanasia. From the Merriam-Webster Dictionary, the definition of euthanasia is the act or practice of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reasons of mercy. I'd like to also define death because nowadays death has a very big term, because like someone could be brain dead but still be alive, but people most likely consider them dead. Well, according to Bertram and Elsie Bandman, death is the termination of the process of life. It is necessary and inevitable, not a freedom and so not a right. Nothing connected with a person's death is a right. No one has freedom in death or rights in death, because the dead have no rights. Well, a better alternative to euthanasia is actually concentrated efforts to implement programs of palliative care rather than government yielding to pressure for legal euthanasia. Hospice care physicians and medical students better trained in pain management and palliative care can be used instead, so that, because most likely the people that are in pain are suffering like psychological distress, and we should be there to help them, not help end their lives. Assumption that suicidal people are competent and make rational decisions to die is false. These attempts are cries for help that should be answered. According to Osteen and Balch, a number of studies show that terminally ill patients are suicidal because they are depressed, not because they're sick. An example of an incompetent person would be an elderly person in a nursing home who can barely understand a breakfast menu is asked to sign a form consenting to be killed. Is this voluntary or involuntary? Will they be protected by the law? How? Right now, the overall prohibition on killing stands in the way. Once one signature can sign away a person's life, what can be as strong as protection as the current absolute prohibition on direct killing? The answer is nothing. Another reason why euthanasia may not be well is because patients might want euthanasia for the sole fact that they may be feeling fearful and vulnerable of the pain and suffering that lies ahead. This fear may also lead to depression, which brings them to a greater disparity of what comes ahead of them. Euthanasia also brings forth a slippery slope argument. Voluntary euthanasia, which is having physician-assisted suicide, is the start of a slippery slope that leads to involuntary euthanasia, which is like having nothing at all, like no medical treatment or anything. They just let their course run out and die slowly without help of medical care. And voluntary euthanasia is the start of a slippery slope that leads to involuntary euthanasia and the killing of people who were thought undesirable. Once a patient has the means to take their own life, there can be increased incentive to care for the patient's symptoms and needs. The case of Michael Freeland is an example. Michael had been given a lethal prescription, and when his doctors were planning for his discharge to his home from the hospital, one physician wrote that while he probably needed attendant care at home, providing additional care may be a moot point because he had life-ending medication. His assisted suicide doctor did nothing to care for his pain and palliative care needs. This seriously ill patient was receiving poor advice and medical care because he already had in possession lethal drugs. Another reason why physician-assisted suicide should not be legal is because it will be used as a means of health care cost containment. Cost containment would become the engine that pulls the legislative train along the track to death on demand. Those who advocate dismantling the barriers that now protect patients from assisted suicide recognize the power of cost containment. This is from Rita Marker. Euthanasia, in most cases, is not the best interest of the patient. Patients may be under pressure because of the shortage of resources to care for them, and they feel that they are a burden to others. So they want to end their lives quickly. Alright, laws against euthanasia and assisted suicide are in place to prevent abuse and protect people from unscrupulous doctors and others. They are not and never have been intended to make anyone suffer. And for those people that are religious, the Bible states that in the 6th commandment, thou shalt not kill. Euthanasia is in all forms contrary to nature and against the law of God. Another problem is that if euthanasia was legalized, the relationships of trust between doctors and patients can be destroyed. Doctors are meant to preserve life, not to destroy it. The answer to euthanasia is pain management, not death. With the drugs offered today, pain can be controlled and virtually eliminated with today's technology. Thank you.